Hey guys, welcome to Internal Medicine and Beyond. I'm your host, Varun Aitharaju, and I'm a fourth year medical student at Northeast Ohio Medical University. This podcast is for aspiring internists and subspecialists eager to learn about the breadth and variety of internal medicine. I know as a medical student, I hear about the variety this specialty has to offer, but I decided to start this podcast and personally hear stories from physicians so they can talk about their experience in this specialty. Here I have Dr. Ankur Kalra, an interventional cardiologist at Indiana. He has many passions within and outside of clinical medicine as a researcher, a CEO for Make a Dent, a poet who published the book Ibadah, and developer of the podcast Parallax, in which he talks to renowned cardiologists about groundbreaking developments in the field. Thanks, Dr. Kalra, for coming on.
Hey, Varun, thanks a lot for having me. We crossed paths for the first time when we both were, TEDx speakers for Neomed's first TEDx, and I remember your talk, and it was great for me to see someone at your stage doing it so beautifully and with such aplomb. So, congratulations, both for landing a TEDx talk and for hosting the podcast.
Yeah, thank you so much. It's nice reconnecting with you.
Yeah, likewise.
So for our first question, why did you choose to pursue internal medicine and later cardiology?
So internal medicine was sort of homegrown for me, for lack of a better word. My father is an internist and a cardiologist, and growing up in New Delhi in India, I would, frequent him to conferences and, both national conferences and conferences overseas. And I would frequent his, clinic visits as well as his home visits, at the time when he was practicing. And this is when I was growing up in the mid to late 80s. Home visits were very common in India. So I would just frequent him to all the home visits. I would probably just sit in the car. Many times he would just take me along to his patients' houses. And, those experiences were very impressionable for me because I could see the reverence that his patients had for him, and I could see the bonding of the physician in my father and his patients. And in lieu, I mean, of course, he would charge a fee, but even more than that was, just the adulation and the respect and what he got for goodies. When he would frequent patients at their homes, and this is like homemade pickles and homemade jaggery in India, and homemade Indian breads. And I just was drawn to the reverence that his patients had for him. So from very early on, as far as I can remember, asking myself this question as to what I want to pursue for a career. A physician has always been the answer. Now, to answer your question on internal medicine and cardiology, internal medicine for the longest time in medical school, I thought I'll be a surgeon. I sort of liked doing things with my hands, and it gave me the gratification of actually having quote unquote done something. But that changed when I was in my fourth year of medical school. I found surgery to be very unengaging cognitively. I mean, it certainly is a very skillful specialty, and if you then venture into subspecialty, it certainly requires a great degree of skill and a great degree of training. So of course, and this is by no means taking anything away from our surgical colleagues, but to me, it just felt that I was more cognitively pushed, challenged, and enthused by internal medicine. And I liked problem solving. I liked to come up with a broad differential and then narrowing it down to a diagnosis. So when sort of you match those cognitive skill sets with what you want to do in terms of doing procedures, I think cardiology becomes a natural subspecialty within internal medicine that you'd pick, because it gives you best of both the worlds, right? You're cognitively deeply involved with decision making and coming up with a broad differential and then establishing a diagnosis. And once you establish a diagnosis and then you want to train yourself into altering the disease course of that particular patient, it's a skillful field where you can do a myriad of procedures, whether it's procedures at the bedside, temporary pacemaker insertion, intra-aortic balloon counterpulsation, pulmonary artery catheterization, all the way to being in the cath lab and, revascularizing coronary disease or, deploying transcatheter heart valves. So, certainly there has been an evolution in the procedural aspect of cardiology through the past 4 decades, certainly the past 2 decades with the advent of TAVI. And we can talk more about that. But, I'm sorry for the long-winded answer, but that in essence is my pathway to internal medicine and cardiology.
Yeah, definitely. You're right. Cardiology is a very, very broad specialty. So speaking about that, what are some of the most important qualities for an interventional cardiologist like yourself?
So first of all, the ability to be a really good internist and the ability to be a really, really good cardiologist, that is a sine qua non for being a really good interventionalist. They all go hand in hand. And with interventional cardiology, the other, I think, important quality is to be able to make decisions on the fly and think expeditiously, and be on your feet and sort of adapt to situations which change in a matter of seconds and be prompt and have those reflexes where you can react appropriately. It sort of takes time to get there. I think the more you train and the more you are in the lab, the better you get at it, like with any procedural based field. But I would say critical thinking on the fly, being on your feet, being attentive. It's sort of very meditative, actually, if you ask me, because it's one of the few times you are really in the moment at all times, because there's nothing else that you can afford to think. You just are so focused on the present moment and the now that it almost is very meditative, when you're in the cath lab doing the procedure. And what I mentioned earlier, you have to be just a really good internist to begin with, and also a really good cardiologist for you to be able to make the right diagnosis and come up with the right treatment plan for your patients.
Makes sense. So tell us about your involvement in founding a nonprofit, Make a Dent, and why you started this.
So Make a Dent is a spiritual calling for me. It's an expression of platonic love. It's an expression of the greater good. And it has given me a new meaning, a new purpose, and a new dimension to my existential being. Through Make a Dent, the idea is to think of concepts which are novel, not only in terms of innovation and how things are done, but also how we think of things, and certainly also addresses concepts which are now becoming fairly mainstream. I'm talking about health disparities and also diversity, equity, and inclusion. So the scope is broad. The foundation and the motivation is platonic love and love for the greater good. The North Star is to be the change, which is Gandhi's philosophy. And the date is September 16th, which was one of the pivotal dates in the movement for freedom, when Gandhi fought against the British Raj for India. And through Make a Dent, we've taken on several initiatives, but I would say mostly projects, research projects, which focus on four broad topics. I did mention a couple of them previously. Health disparity is an important topic. So we've done a lot of work addressing health disparity. and then there's diversity, equity, and inclusion. So we've done, we've looked into databases, and we've published reports on, gender and race, and how that affects opportunities for our colleagues in medicine. And then, obviously there's the science. So there's heart and vascular, which certainly is an area of active clinical investigation for Make a Dent. And then there's South Asian heart health, which is, very close to my heart. I mean, you're a South Asian, and, us, simply by the virtue of being South Asians, are at heightened risk for atherosclerosis. So, Make a Dent has an initiative called CHAI. No puns intended. I mean, chai is one of the most commonly drank drinks in India. I'm sure you know. I'm sure everyone who's listening knows. But it stands for cardiovascular health in Asian Indians. And the idea is to bring together, epidemiologists, cardiologists, interventionalists, preventive cardiologists, whoever is interested and wants to contribute to better understanding of why there is, or why there remains, a heightened risk for atherosclerosis in South Asians. That's the initiative, and through this initiative, we've sort of published a few reports, which are available on Make a Dent's website and can be accessed. So those are some of the broad areas where Make a Dent has invested its money and its efforts. And then there's certainly the podcast Parallax, which Make a Dent is a proud co-host. I can say it's published by Radcliffe Medical Media Group in the United Kingdom, and it's an association with Make a Dent. So, those are some of the initiatives and some of the projects, and some of the podcasting, that we do. And, with podcasting, again, really the focus is to bring forward discussions which talk about issues which, may be considered taboo, or talk about issues which have been considered, sort of closed door conversations. We sort of want to bring them to the fore, so that, colleagues who are struggling with those issues have a platform where these things are discussed openly and honestly.
Sounds great. Yeah, it looks like Make a Dent has a lot of avenues to kind of explore, whether it's research, whether it's public health and diversity inclusion. And I like that acronym. It's a great acronym, CHAI. So, you've been very involved in cardiovascular research for the majority of your career. What about research has continued to fascinate you?
So the one thing which, has been the flavor of my research has been that most of these questions have actually been asked at the bedside. And or if you look at health disparity and also look at diversity, equity, and inclusion, these questions have come to the fore and have sort of bothered. I don't think they've bothered. I mean, they've certainly made me very inquisitive. They have bothered me. I should say that they have bothered me as to why there is a particular inequity, or why certain things are done in a certain way, shape, or form, or why isn't there equitable distribution amongst colleagues for opportunities, and why do race and gender play such an important role. So I think it's important to be observant. It's important to be curious. It's important to keep asking questions at the bedside. It's important to know what the evidence is. It's important to also know where the evidence is lacking. That's how you come up with questions for research. And the more you think in that fashion, the more you develop that muscle, the more it will serve you, because it'll just become your way of being. You'll just keep asking questions. And the more you ask, the more you have to answer. And the more you have to answer, the more research you have to do. So I think it just becomes a way of who you are, as a physician or as a clinician scientist. It's just how you become. I mean, you just, every decision you make, every step you take, you go back, you read the literature, you ask yourself questions as to what the data are. Is there enough evidence to pursue this step for this particular patient. And if there isn't, then you sort of go digging. And if you can't find it, well, there you go. You have a new research question.
Yeah, that's a good point. As an author of the poetry book Ibadah, tell us about your inspiration writing this book and how clinicians can balance art with medicine.
So that was also the topic of my TED Talk. It was the science and the art of a broken heart, and I sort of presented both avenues. Avenues of broken heart as an artist, so through poetry, and then avenues of broken heart as a clinician scientist when we published, broken heart syndrome research through my former appointment at the Cleveland Clinic, where we demonstrated a 4.5 to 5-fold increase in the incidence of broken heart syndrome during the pandemic. So 2020 was an interesting year for me because the poetry book was launched actually by the Cleveland Clinic Arts and Medicine Institute on Valentine's Day in 2020, and then the pandemic hit, and so all my poetry book readings were canceled. And then we were just seeing these cluster of cases of broken heart syndrome, and I begged the question as to if this is just a chance occurrence or if this is actually happening because of the pandemic. And we did end up answering that question scientifically. But getting back to balancing art and medicine, I think art is an important outlet. At least it is for me. It is important for me. See, Varun, I'll tell you this. As a clinician, particularly as an acute care clinician, you'll come across a myriad of emotions through your patients, and even if you are not directly involved with their distant relatives, or even with the family that visits them after they have gotten acute care, you sort of experience these emotions when you are taking care of them in the throes of a cardiac emergency. And when that happens, there are two ways to handle those emotions, right? One is you can become immune to them, and maybe that works for certain people. It obviously does not for me. I just like to be with my patients, and I like to be vulnerable with them. So when you assume vulnerability with patients, and when you sort of are there for them when they are at their most vulnerable stages, in their lives, I think you have to process a lot of emotion. I mean, I'm an emotional person. I don't know if that's a right thing or a wrong thing, but that's just who I am. So for me to be able to balance what I'm absorbing on a daily basis and then still go back each day with the same vigor and the same enthusiasm and the same focus, I need to be able to process vulnerabilities that I get exposed to on a daily basis. So I need to be able to journal all the emotions that I see. So I saw a lot of, as you certainly see a lot of love, you see a lot of loss, you see heartbreak as an acute care clinician. And, for me to be able to process all these emotions, the best form I thought was to write. Now I wanted to write a love story. And that's just because I love writing, and also that I'm inspired by the Bhagavad Gita, and I find there is a lot of relevance for the Bhagavad Gita in our modern day lives. And I've been a follower of the Bhagavad Gita thanks to my mother, who's been reading Bhagavad Gita ever since she was 21, and she's 65 now. And so again, born and bred in New Delhi, I was fed on the Bhagavad Gita. So that text has been my foundational guide. And when I see avenues where I can translate those teachings into applicability into our modern lives, I don't want to lose that opportunity. So I wanted to write a love story, and I wanted the foundational principles to be based on the Bhagavad Gita, and I wanted it to be set amidst war, like the Bhagavad Gita was. And so what I did was, with the experiences that I was vicariously having through my patients, I would write these proses, and then I would convert them into poetry. so that I could one day put together this book, this novel, this love story that I'm writing. Actually, I still am. Um, it does have a release date now. Finally, it's going to be released in 2024 on Valentine's Day again. But when I showed the collection of poetry to my friend, who happens to be a New York Times bestselling author, she said, "Look, in and of itself, this collection would form a fantastic poetry book. So why don't you just put these together in the form of a poetry book? Um, it'll do two things for you. One, it'll actually make you go through the process of putting things together and coming up with the book. And two, it will give you the audience and it'll give you the feedback that you can utilize when you are actually writing the novel." So I thought that was a great idea. That was a brilliant idea. So it was a self-published endeavor. I found a publisher, and the publisher said that there was room for them to publish a poetry book, that this would be a good collection for them. And I think we went on doing this by initially actually advertising the poems on Instagram to see if there is receptivity to these poems. And when we found that there was good receptivity, then the publishers were convinced that we could put this together in the form of a poetry book. So that's sort of the background story, the genesis, the motivations, the inspiration of how I landed up with a poetry book in 2020. But I can tell you that the seed for it was sown in 2018. So it took me about a couple of years to come up with this neat little book of poetry, which has about 30 poems. So it took me that long. But at about the same time, I also started writing. I believe it was early 2019. I started writing the novel, which if you date back, probably will take me close to 5 years. But the reason I even bring these time dimensions is not that time and space. I mean, time and space are very relative in the grand scheme of things, in my opinion. I think if you are doing work which is timeless, like the Bhagavad Gita, then it will find its audience for ages and ages and ages. Um, I just bring up time because for the listeners to get a sense of how long it takes, that anything meaningful that you do takes a good amount of time and takes a lot of thought and planning and action. So I don't know if that answered your question. I mean, again, it was a long-winded answer, but I wanted to share basically how the poetry book was born.
Yeah, definitely. It's a very incredible journey. I think it's very inspirational. So, Dr. Kalra, it seems like art for you is almost like an outlet for a lot of the emotions that come with practicing medicine. I think that's a really good point for, with burnout rates, on the rise for a lot of specialties. It's important for people to understand that art and, the different ways you express your emotion can be a good outlet for a lot of the stress that can be happening, or a lot of the emotions, that positive and negative, that happen with practicing medicine.
Oh, absolutely, without a doubt.
Yeah.
Absolutely. Mm-hmm.
So, Dr. Kalra, we talk about a lot of the different things you've been involved in as a poet, as a podcaster, as a CEO. How do you recommend students or residents balance non-clinical interests, like the ones we just described, with their clinical duties?
Yeah, Varun, I think the first thing is that needs to be brought to the fore is that your foremost responsibility is toward your patients. So you have to be responsive, and you have to be available for them, and you have to keep that as the fulcrum of your existence. If you are a practicing physician or a clinician. Other things, I'm not saying that they're less important. They are important. I think each of these things, form the whole person that you are. And it's important that these things find expression, right? Because finding expression is balancing your existence. So for me, for med students, or even for residents or trainees who are listening, the one important message here is that first and foremost, do your job well, take care of your patients, and make sure you're available for them. And then do find time for vocation. Do find time for doing things which give you purpose and give you meaning. Because medicine, can be brutal. It can be cruel. You can get completely consumed, and you'll find that in due course you'll start experiencing burnout. Actually, we recently, as of 2 days ago, just published an article inspired by the Bhagavad Gita on the conflict of burnout, which was published in the European Heart Journal. Um, so it's important to find your constant source of inspiration, whether that is spirituality, whether that is an expression of art, whether that is painting or poetry, or whether that's bike riding or hiking, or working out, or high intensity interval training. So it's important to find expression for everything that you want to do and pursue in your life. That's what gets you a whole life, in my opinion. So many people have asked me, how can you do, or how have you done a myriad of these things and done them on a consistent basis, and done them well? And the answer is find time and basically devote time to that one particular task, and assign days. For example, most of my podcast recordings I do on Sunday evenings. Most of my writing I do on Friday evenings. A lot of the research actually happens between cases, or when I'm waiting for the room to get ready. I mean, a lot of the editing of the manuscripts happens between patients, and you can say that can call for a very busy day, and it certainly can. But if it fulfills you, you will not feel burnt out. You'll not feel busy. You will not feel that this is another chore. It'll actually give you meaning. So for me, the research that I do through Make a Dent gives me a ridiculous amount of meaning in my life. Like it's my life's purpose. If everything is taken away from me, I'll still be fulfilled and I'll still be happy because I have Make a Dent. Similarly, poetry gives me a lot of meaning. So if everything is stripped away from me, I can still do my poetry, which again is an outlet for me. It's an expression for me. But I think I think the point that you're trying to make, and that the point that you're asking, is that how do you balance doing all these things together and doing them consistently? The answer is just having discipline. And I say, in the crucible of discipline lies freedom. So if you are regimented and disciplined, and if you have assigned hours or hour and assigned days of the week to all these tasks, then you can be rest assured that Friday evenings is going to be your writing, and Sunday evenings is going to be your podcasting. And that way you are compartmentalizing tasks which you want to accomplish, because they also give you a dimension. They also give you meaning. They also give your existence the purpose, whatever that purpose may be. That's how I think of this, and that's how I execute this, if that answers your question.
Yeah, definitely. That's great advice. Scheduling your activities accordingly, but also finding meaning in them, and I think that will kind of carry it well. So finally, for a student or resident interested in cardiology, what is your strongest piece of advice?
The strongest piece of advice is to work closely with your cardiology colleagues. Work closely with cardiology fellows. Research has always been key to applications in cardiology. So I would encourage applicants to get involved early. A lot of the times what happens is that residents seek quick projects because they want to apply for a fellowship, and they want to be done because they want to be able to show X, Y, or Z number of publications on their resume. That is fine. That's a short-term goal. If that's what you have in mind, then make certain that you are spelling that out to your mentor, that, look, research is not for me. I'm deeply interested in cardiology. I'm a decent clinician. I have done well in my cardiology rotation. I want to pursue it as a field. I find a lot of meaning and a lot of gratification in taking care of these patients. I know cardiology applications are competitive. I need help in building up my resume. If I can be of help in any of the ongoing research projects, or if I can be of any help in any of the pending writing assignments that you have, please let me know. Then if you do that, the one thing which is crucial is don't let your mentor down, right? So make sure that you are fulfilling and meeting all the deadlines and meeting all the expectations in terms of wrapping up projects and wrapping up data collection and writing them up and getting them analyzed. Because the last thing you want is to seek someone for an obligation and then not turn up and do the work the way it should be done. So know what you can do and get involved early. I think the best stage to get involved is actually medical school, because internship gets busy. Second year of internal medicine residency is usually nerve-wracking because you're the senior taking care of your interns and you're running the service, and it's important to be a really good resident. It's important to be clinically sound and clinically very good for you to be a good cardiology applicant. So I think if you get involved early, in your third year or fourth year of medical school, identify a mentor who can actually give you really good projects, like first author papers, or certainly in the top 3 as a medical student. I think those are important goals to keep in mind when you're approaching someone. And then one thing I always ask is, when you are approaching someone for research, don't approach. And look, like I said, not everyone is cut out for research. Not everyone is meant to do research. You'll have incredible clinicians who will take great care of patients, but they're just not researchers. And then, there's vice versa. And then you have a combination of both, like people who will do really good research and people who will do really good clinically. So I think it is important for you to do the homework as to who you're approaching. Do a quick PubMed search on that particular person you're wanting to approach or trying to approach, and see what they've put out. What their theme is in terms of the verve or the flavor of their research, if that sort of resonates with you. And if it does, then approach that person who's been productive, so that you for sure know that you are going to get something out of your effort that you put in, and the time that you spent and invest with this particular person. So those are some of the housekeeping sort of nuggets or points that I think should be discussed or are important for anyone who's planning a career in cardiology, to be a successful cardiology applicant.
Awesome. Thank you so much, Dr. Kalra, for coming on. Your answers are very inspirational, educational. I'm sure the students, residents, and even attendings listening will find a lot of use in that. So thank you so much.
Yeah, no, my pleasure. Thanks for having me.